Let me ask you something very directly. Have you ever felt like you need to go to the bathroom? You sit down, you strain, you wait, but nothing really happens. Or even worse, you feel like something is right there at the very end, but it just won't come out. You try again and again. You stand up frustrated, and later the same thing repeats. If this sounds familiar, this is not just normal constipation, and it is definitely not something you should ignore or keep trying to force out. Because when stool becomes stuck in the rectum, it is often a sign that your digestive system is no longer coordinating properly at the final stage of elimination. My name is Dr. James, a urologist with 12 years of clinical experience working with pelvic function, urinary health, and bowel-bladder interaction disorders. And today, I'm going to explain exactly what it means when stool gets stuck in the rectum, why it happens more often with age, and the step-by-step safe approach you should take. Because in many cases, what people do next is what makes the situation worse. Let's clear up a serious misunderstanding first. Most people think this problem is simply about hard stool, so they try more straining, more force, random laxatives, waiting, and hoping. But medically, stool stuck in the rectum is often not just a stool issue. It is a coordination failure between muscles, nerves, and hydration balance. A 2019 clinical review in gastroenterology showed that most cases of rectal stool retention in adults over 60 are linked to slowed bowel motility and pelvic floor dysfunction, not sudden blockage. That means the problem is not just what is inside you, it is how your body is trying to release it. And once that system slows down, stool does not just pass normally anymore. It starts to sit, dry out, and become increasingly difficult to pass. Now let's break down what is actually happening inside your body. Number 3, the slow movement trap. Your colon is not just a tube. It is a muscular system designed to move waste in waves called peristalsis. These waves gently push the stool forward until it reaches the rectum. But here is what changes with time and lifestyle. As we age or become less active, these waves slow down. And when stool moves slowly, more water is absorbed, stool becomes harder, and movement becomes more difficult. Now imagine the stool reaching the final section, the rectum, and sitting there longer than it should. It gradually loses moisture, and the longer it stays, the more compact it becomes. This is how normal constipation quietly turns into a stuck sensation. A 2020 digestive motility study found that delayed transit time was one of the strongest predictors of incomplete rectal emptying. In simple terms, the slower your system moves, the more likely stool becomes stuck at the exit point. But slowing movement is only part of the problem, because even when stool reaches the rectum, another issue often appears. Number 2, the exit coordination problem. This is where many people get confused and frustrated because they feel the urge. They sit down, they try, but the body does not fully release. This is often not because stool is too large. It is because the final muscles responsible for relaxation are not coordinating properly. The rectum must push while the pelvic floor muscles must relax. But in many adults, especially after years of ignoring bowel urges, rushing bathroom time, straining habits, or chronic constipation, that coordination becomes disrupted. So what happens? The body tries to push, but the exit does not fully open. A 2021 pelvic function study showed that nearly 40% of patients with incomplete rectal evacuation had pelvic floor dyssyneria, meaning the muscles were not relaxing correctly. This creates a frustrating loop: strong urge, incomplete release, repeated attempts, and more irritation. And over time, the body becomes even more confused about how to finish the process properly. But there is one more critical layer that most people never realize, and this is the part that often keeps the problem going. Number 1, the false signal effect. This is the most overlooked mechanism. When stool sits in the rectum for too long or is repeatedly partially passed, the nerve endings in that area begin to become less sensitive, meaning your body stops clearly recognizing when evacuation is complete. So instead of a clear, empty feeling, you are left with lingering pressure, uncertainty, repeated bathroom visits, and a feeling like something is still inside. This is not imagination. It is a real neurological adaptation. A 2017 clinical study on chronic bowel dysfunction found reduced rectal sensory response in patients with long-term incomplete evacuation symptoms. In simple terms, the communication between your rectum and brain becomes less precise. So even when things are mostly empty, your body still feels unfinished, and that is what drives repeated straining and often worsens the problem. What you should do safe step by step. Now, let's focus on what actually helps, because this is not something you fix by forcing harder. In fact, forcing is one of the worst things you can do. So, here is the safe clinical approach. Number 1, stop straining immediately. Straining increases pressure but does not improve coordination. It can also worsen hemorrhoids, rectal irritation, and pelvic muscle dysfunction. If nothing is coming out, forcing it will not help. Number 2, change your position. Your body is not designed to eliminate while sitting at a 90-degree angle. Use a small footstool to raise your knees slightly above hip level. This straightens the rectal angle and improves natural release. Number 3, use a gentle hydration strategy. Dehydration makes stool harder and more resistant. Drink water steadily, not all at once. Warm fluids can sometimes help stimulate movement. Number 4, give your body time, not pressure. Sit for a short period of 5 to 10 minutes. If nothing happens, stand up and try again later. Do not turn it into a prolonged straining session. Number 5, restore daily bowel rhythm. Try to sit at the same time every day, especially after breakfast. This activates your natural gastrocolic reflex. Important warning. If you experience severe pain, complete inability to pass stool or gas, or worsening abdominal swelling, you should seek medical evaluation promptly, because in rare cases, stool retention can become more severe and require professional treatment. If you are dealing with this, I want you to hear this clearly. This is not a broken body. This is a system that has slowed down and lost coordination, and in most cases, with the right adjustments, it can improve significantly. Your body is not failing you. It is just giving you signals that something needs to change. Now I want to hear from you. Have you experienced this feeling of incomplete emptying or stool getting stuck? Tell me in the comments. I read every single one, and your experience might help someone else who is silently struggling. And if this video helped you, make sure you hit the like button, but more importantly, subscribe to the channel, because in the next video, I'm going to explain something even more surprising. Why your bladder and bowel problems often come from the same hidden root cause. Take care of your body and listen to the signals it gives you before they become a bigger problem. I'm Dr. James, and I'll see you in the next